Hello, my name is Mia Kanak, and I'm a pediatric emergency medicine fellow at Children's Hospital Los Angeles. My colleagues and I are excited to present our work titled Mobile Social Screening and Referral Intervention in a Pediatric Emergency Department. The background of our project is that prior studies have found many families in pediatric emergency departments to have unmet social needs, which may be detected and addressed with the use of electronic screening. The objective of our study was to characterize the effectiveness of a mobile screening referral app called HelpSteps and to assess its impact on clinical flow in a pediatric emergency department. For methods, we conducted a prospective trial with a convenient sample of adult caregivers and patients in the Boston Children's Hospital Emergency Department. Participants were given the choice to either use HelpSteps on their personal phone or an ED tablet. Zooming in to show you what the app looks like, the app first screened for social needs across 5 domains: food, housing, transportation, utilities, and interpersonal violence, using the CMS Accountable Health Communities Health-Related Social Needs Screening tool. Then, participants had the option to self-select a referral from 21 need categories, as shown here on the left side of your screen. The selection then prompted a list of social service agencies based on geographic proximity, shown here in the middle, that the participants could then click on to learn more about and receive information about via text, email, or printed handout. Participants then completed a 1-month follow-up survey. And additionally, on the day of enrollment, clinicians were surveyed about family needs and the impact on ED length of stay. Moving on to results, of 258 participants, 85% were female and the median age was 37. 18% of participants self-identified as Hispanic and 15% as Black. 56%, or the majority, elected to use HelpSteps on their personal phone. 88% of participants agreed that screening in the pediatric emergency department is appropriate, but only 10% were screened for social needs by their clinician during that visit. 95% of clinicians reported the intervention added no additional time to their clinical visit. Now I'd like to focus your attention to Figure 1, which shows a comparison of needs identified by a positive screen versus by self-selected referral. Zooming into these overlapping circles, the purple circle represents participants who both screen positive and self-selected referrals for food, housing, transportation, utilities, and/or interpersonal violence. The blue portion represents participants who screened positive but did not self-select a referral, and the red portion represents participants who screened negative but did self-select a referral. For example, looking here at the circle on your left for overall need, 54% of our participants were found to have social needs. 31% of participants both screened positive and self-selected a need. 16% screened positive but did not self-select a need, and 8% screened negative but did self-select a need. Looking across at the 5 additional circles, which each represent a domain of need, the lack of, quote, purple overlap highlights discrepancies between screen needs and self-selected needs. Moving on to Figure 2, which highlights the effect of our HelpSteps intervention at 1 month. 79% of participants who self-selected social needs were reached for follow-up, of which 44% reported their top need was completely or somewhat resolved. Of those, 77% reported that HelpSteps was useful in finding a solution to their need. In conclusion, mobile social screening was both well-received and effective at identifying and referring families for social needs with minimal impact on ED clinical flow. A majority of families elected to use their personal phones, but the availability of a tablet improved screening rates. Last but not least, our experience found that a screening tool may fail to identify desired social services and thus an option to self-select referrals may maximize referral opportunities. Thank you so much for your time. I'm looking forward to hearing your feedback and answering any questions.